Hello, this is Cameron Sabat from Cutting to the Case, and I'm here with Dr. Ben Taylor, Editor-in-Chief of Orthobullets and Chair of Orthopedic Surgery at OhioHealth here at Grant Medical Center. Nice to meet. Thank you very much for hopping on our podcast today.
Oh yeah, no problem.
Thank you. So as Chair of Orthopedic Surgery at a busy Level 1 trauma center, how do you think the demands of urban trauma shape resident education differently than in smaller rural centers?
First, I'd probably say the volume. The breadth of cases is also probably the other aspect of that there. So you're seeing literally anything that can happen out there in the real world happens and comes in here. So I think the residents get great exposure to both volume as well as the breadth of care.
Yes, yes. And, expanding on that breadth as well, you've published over 100 peer-reviewed articles and contributed to multiple textbooks. What areas of orthopedic research do you feel are most underexplored right now, and where should young investigators focus their energy?
I think the most cutting edge would probably be biologics or, influence of healing on a wide variety of things. That could be ranging from sports to joints to trauma, obviously, there. And so, much of the data and information on implants is already out there. So I think that's kind of an older field, but still important to delve into. But I think that probably the most cutting edge would be biologics, and then even considering the role of computers in future treatment.
Certainly, certainly. And, speaking of computers and technology as well, Orthobullets, where you're editor-in-chief, has become foundational for residents and students worldwide. As editor-in-chief, how do you envision its role evolving over the next decade, especially with AI and personalized learning?
And so that's actually a big focus of Orthobullets now, is working on the AI aspect of improving users' really experience with the website, as well as trying to help guide them through their learning there. So by identifying deficiencies, working on strengths, and try to improve the overall outcome in a time efficient manner. I think in addition, kind of incorporating more video learning, more maybe even augmented reality or virtual reality learning too will be down the road.
Certainly, certainly. And you're also heavily involved in both trauma and sports, both two high stakes, high pressure subspecialties. What are some core decision-making principles you teach fellows to handle these critical scenarios confidently?
I think, starting with the basics and the foundation, working on that, and expanding from there. Most of the things we do have a core, so trying to kind of expand after that, whether it's creativity required in trauma or with some of the basic anatomy and concepts of sports, including where specific ligaments and such go. So knowing the core and being able to expand from there is probably the biggest thing I try to teach.
Yeah, you're trying to nail down that confidence with the anatomical. And about that confidence, you're a fellowship director and associate program director across multiple residencies. What key traits do you look for in residents who thrive not only clinically but also as future leaders, those confident people?
I think it's people that work hard. So again, it's never get in trouble for working too hard. So that's one thing that's hard to teach, but we can identify. I think the other thing we look for primarily are patient or students that want to learn. So students that come in and either have a expectation or kind of preconceived notion of how something should be done, probably not the best idea. So if you're coming to a place to try to learn, you should probably try to learn.
Absolutely. And second to last question, mentorship really seems central to your career. Can you share a story of a mentor who profoundly shaped your approach to surgery or leadership, and how you try to pass that forward?
Mm-hmm. And so that's a good question. I think a lot of us, as we get, through training and all, have multiple people that we've relied on there. And so I've had multiple surgeons who've been influential on me. There's some more than others, of course, but there's Dr. Polka, who was in my role here previously, is probably one of the biggest, if not the biggest, kind of shaping how I do things here. So, but I've been lucky to work with some great guys and been able to steal little parts and little bits from each of them and kind of meld it into my own.
Certainly, certainly. And really, final question for our viewers today: do you have any recommendations or advice for medical students or residents or people in training moving forward?
I think it's trying to get exposure to as much as you can. So whether it's volunteer work, whether it's trying to work on a research project, whatever it may be, in medical school, getting involved with orthopedic interest groups, but also not, being just closed to that. Trying to expose yourself to other fields is also important there. So you can learn from any situation, any clinical experience. So the more the better. And I think probably the final one is just don't give up. Things may not look like they're working out. Just keep trying, and things always end up working out somehow.
Resilience and experience, the two kings. So I appreciate it. Thank you very much.
Yes.
Yes, wonderful. This is Cutting to the Case. Cameron Savitz signing off.